This is Breakthroughs, a podcast from Northwestern University Feinberg School of Medicine. I'm Erin Spain, Communications Director at Feinberg. An important finding detailed in a new Northwestern Medicine study warns of the role certain kinds of meat may play in increasing cardiovascular disease risk and premature death. Dr. Norrina Allen led this research and joins me today. Dr. Allen is an associate professor of preventive medicine and pediatrics and the director of the Center for Epidemiology and Population Health within Feinberg's Institute for Public Health and Medicine. Thank you so much for being here today.
So glad to be here.
Finding ways to prevent cardiovascular disease is a big focus of the work that you do here at Northwestern. Just tell me a little bit, big picture, what are the goals of the projects that you take on here?
So we have seen major improvements in the number of deaths from heart disease over the past several decades. But unfortunately, over the past several years, we have seen an increase in cardiovascular mortality. And our work is really focused on trying to understand why that resurgence of heart disease is really happening and the role that lifestyles and behaviors may be playing in the risk for heart disease among our population.
And, we're here to talk about meat consumption, as I said, but listeners may remember that you were on the podcast last year talking about egg consumption and heart health. Refresh our memories on that study.
Sure. Our work has really looked at a variety of behavioral and lifestyle as well as clinical risk factors for heart disease. One area we've been focusing on is your diet. It's something we can all change and we all want to improve. The study that you referred to about eggs demonstrated that the higher number of eggs that you eat per week was associated with increases in your risk for heart disease and stroke over 30 years. And we were also interested in understanding what other components of the diet may be impacting your risk for heart disease.
And that comes to this study today. So you're using the same data set as the egg study to look at meat consumption. Is that right?
That's correct. So we brought together 11 cohorts to actually combine their information together to understand how those participants, how their diet, I should say, impacted their risk for heart disease over the long term. So we then followed them for 30 years through those cohorts. And we found that individuals who consumed higher amounts of processed meat and red meat had a higher risk for heart disease and mortality. In addition, I think what's important to remember is that these relationships are independent of the other risk factors that we also measure. So if you have high cholesterol, this is already taking into account the high cholesterol. This is potentially through some other mechanism. If this causes you to gain weight through obesity, your BMI is already taken into account in this model, and this is the effect above and beyond that. So these parts of the diet may be contributing to your risk through other cardiovascular risk factors, as well as independently directly on your risk for heart disease.
So this study on meat, and you just said what the big finding was here, is published in JAMA Internal Medicine. Tell me a little bit more about the specifics of this finding.
So we found that for every 2 servings of processed meat that people consume per week, they had a 7% greater risk for heart disease and a 3% greater risk for mortality. For unprocessed red meat like steak and beef, they had a 3% greater risk for cardiovascular disease and a 3% greater risk for mortality overall. Interestingly, we also looked at the effects of poultry, so chicken and turkey, on heart disease and all-cause mortality. And poultry was associated with an increased risk for heart disease, a 4% increased risk for heart disease, but there was no effect on mortality. And the amount of fish you consumed in a week was not associated with either heart disease or mortality in this study.
And something that maybe we don't always know is how some of this food is being cooked. And that does impact heart health, right?
So that is an important limitation to consider. We only had their diet at the beginning of the study, so we weren't able to examine the changes in their diet over time. And we also didn't have information about how they cooked or prepared their foods. So whether that poultry was a fried chicken or ground turkey, we couldn't disentangle that. And I think there needs to be further work to truly try and drill down into the specific types of, let's say, poultry, for example, and the preparation of each of these foods to understand their impact on risk.
But the bit about fish, were you surprised to see that there really wasn't an association either way?
It's interesting. The prior studies that have looked at the amount of fish you eat per week have been very mixed. Some have found a protective association for heart disease and mortality, and some have found no association, like our studies. We think that is in part part due to the small effect size of eating fish, but it also probably has to do with the amount of fish that is consumed in the population. So these studies all took place in the United States. We consume lower amounts of fish than other countries like Japan and Asia, and that may have influenced our ability to identify any associations between the amount of fish you eat and your risk for heart disease and mortality.
So we talked a little bit about we don't know exactly how the food was prepared, like fried chicken versus ground chicken, but also the processed part of it. Talk about that a little bit. What do we know about processed meats, and how does this study sort of line up with what we know?
We've had dietary guidelines for a number of years recommending that people limit and reduce the amount of red meat and processed meats that people consume in their diets. There's been a long history of literature demonstrating their relationship not only to heart disease and mortality, but also to cancer and other outcomes like diabetes. This study, I think, is novel in the size and the ability of our cohorts to be able to disentangle the association between meat and other sources or other foods within their diet, but it is consistent with the prior literature that higher red meat, higher processed meat is related to heart disease and stroke risk.
There might be people out there listening to this saying, I'm so confused. There's been other studies out there recently saying it doesn't really matter if you reduce your meat intake. In this study, that it may be healthier to reduce your meat intake. So what would you like people to kind of come away with when they hear this headline?
Things that we hear about our diet and how we should eat are very confusing and often conflicting in day-to-day life. But the findings from the research have been consistent that higher red meat intake and higher processed meat, bacon, lunch meats, sausages, those are all associated with a greater risk for heart disease and mortality. What came out recently at the end of 2019 was that there's less literature demonstrating that if you cut down your amount of red meat consumed, you will see a resulting decrease in your risk for heart disease and stroke. That's a question that I think we still need to study, of how much do you need to cut back in order to see an improvement in your risk. Despite that, there's strong observational literature to suggest that people should really eat minimal amounts of red meat and processed meat in their daily diets.
And what about people who say, oh, but the protein, I eat steak for the protein. Protein can come from other sources that are not meat.
We have been moving as a society towards really trying to incorporate more fruits and vegetables and whole grains into our diet. There are leaner sources of protein, ground turkey, for example, or egg whites or yogurts and cheeses that may serve as better sources of protein. I think what this study demonstrates is that we should really eat especially red meats and processed meats, in moderation, and really consume them more as a treat, as I tell my children, as opposed to a core part of our diet that we eat every day or every part of the week.
Is there really other groups like that out there looking at cardiovascular disease with such a unique data set?
I think this is one of the real strengths of this paper, is that we're using these very large and diverse cohorts of people, and we're observing what they're actually doing in their real life. So these are the diet, and this is the foods that they're eating in their everyday life. And they're not trying to eat healthier because we're watching them. They're not trying to change what they would normally eat just to influence their participation in the study. We're just really looking at what their everyday diet and how that impacts their risk for heart disease in the future.
Will we be seeing more studies from this data set? Is there more to come about? And you've looked at eggs, now we're looking at meat, and you can kind of start adding all of this together.
This study was related to just one aspect of diet. The Lifetime Risk Pooling Project is an amazing wealth of information, and we are still working on many questions to really explore what are the behavioral, what are the lifestyle, what are the clinical factors that are all translating to reductions or improvements in cardiovascular risk. And so we are interested in trying to identify how we can best make recommendations to increase your likelihood of living a really long and healthy life.
Is that just a Northwestern project?
So it was actually created by our own Don Lloyd-Jones with funding from the National Institutes of Health, and it was combining multiple cohort studies from across the United States, and it's really using that data much more efficiently to ask these questions where you really need a large sample size. You really need 20 or 30,000 people to be able to understand the small effects of a single part of a diet. So that data set is a remarkable resource here at Northwestern, and we continue to work with it in a variety of different projects.
So you feel pretty close to this data set, almost like you know some of these people as you're looking through over time.
Clinical research and population research has been the cornerstone of our department and my own research, and so I actually lead the Mesa Study, which is still collecting data, is part of this lifetime risk pooling project, and we still see these participants come into our clinic and complete dietary assessments and have physical exams. So they remain instrumental to increasing our understanding of heart disease.
And how important is that to have this data over 30 years and to engage these people to continue to be a part of these studies? Tell me a little bit about that process and why it's so important.
Yeah, we have remarkably dedicated participants. Our cardio participants have been with us almost 35 years. Our Mesa participants about 18 years. They are so giving in terms of their time and their discomfort that's sometimes associated with some of our exams, and they do it all for the sake of improving other people's health and providing insights into what health really looks like. And so it's critical. I think a real strength of this study is that we followed some of these participants for 30 years. We followed them throughout their lifetime, and that really gives us insight as to what happened in their early adulthood and how that translates to their risk of heart disease much later in life.
When people hear this study, if there is going to be some controversy out there, I know the egg study people took to social media and there's a lot of journalists writing about it. What do you think is going to be the bit of controversy or confusion with this study?
The relationships between the processed meat and red meat with heart disease and mortality have been fairly consistent up until recently. The more controversial part may be the association we find with poultry and heart disease. And that is an area of work we're trying to understand more in terms of what may be driving that association. And I think that there needs to be greater understanding of specific types of poultry. We've moved a lot towards turkey and using ground turkey as opposed to fried chicken. And that heterogeneity of poultry might be explaining some of the results. But also fish. We've been really advocating for fish being a part of a healthy diet. And this finding doesn't change that at all. But I do think it calls into question the need for more research on how much fish and how often and what type of fish and how is it prepared to really understand what's the best way to increase the health of our diet.
Since you were here last, you've been named the director of the Center for Epidemiology and Population Health here at Feinberg. Tell me a little bit about that role and what that has to do with studies like this that you were talking about today.
So the center is really focused on catalyzing and providing innovative methodologies to increase the impact of the population research that's going on across Northwestern. We have a variety of research interests here, from cardiology to neurology through rheumatology. And so we're really focused on making sure that each of those clinical questions is asked with the best methods and the best data that can be helped to answer those questions. Because at the end of the day, we want those studies to be able to change the health, not just of Chicago, but of the world overall. And we think that that is best done by making sure our quality of our research and the focus of our studies is the highest it can be.
Did you know episodes of Breakthroughs are accredited for CME, Continuing Medical Education for Medical Professionals? Go to our website, feinberg.northwestern.edu, and search CME to claim your credit.